I'm here with Victor Windeyer, Portfolio Manager at Perennial Partners, Manager of the Perennial Future of Healthcare Fund. Victor, thank you very much for participating in the Inside Network's Alternative Symposium, Hunter Valley.
Great, thanks James, it's terrific to be here.
Great pleasure to have you here. Victor, we constantly hear about all the tailwinds behind healthcare, consistent growth due to ageing populations, global demand, developing markets coming along and wanting the same kind of treatments that the developed world had. What specific subsectors within healthcare do you believe are best poised for future innovation and growth?
Yeah, so in healthcare is a very broad universe. The sort of innovative subsectors, if you like, or the innovation subsectors, the growth subsectors, medtech, so medical device companies, biotech, so they're developing new biological therapies as treatments for people with diseases. We've got the pharmaceuticals, which are sort of a mixture between growth and more value style opportunities. We've got health IT companies, so those companies that are at the confluence of the exciting innovations in AI, healthcare, both in terms of innovation, so it can drive efficiencies in service delivery, but also in finding new drugs and biologics. And then we've got life sciences, so life sciences are things like genomic analysis, which can be used for molecular targeted therapies.
You've got a really interesting portfolio in your fund because it's a blend of international healthcare stocks and some quite big ones, and early stage, obviously unlisted, venture capital in situations you like. So what strategic advantages do you see in combining mature and those kind of really nascent markets or investments in healthcare that could be seen as almost as moonshots?
Yeah, I think that's a great question. So really, when we're thinking, it's helpful both ways actually for investment in large companies, but also for the small company investments as well. When you're thinking about a small company, a venture capital style investment, really we want to understand what the end market for that is. If you're developing a new product, a new drug, biologic device, you're trying to disrupt the current practice of medicine, and the large players are the companies that you're trying to disrupt. So when you do a landscape analysis of the potential for your little company, your startup company, what you find is that those large companies, they're the companies you're trying to disrupt, they're the companies you're trying to partner with, and they're the companies that you actually really want you to acquire you in the long run. So that's critically important to understand that and where those larger companies are focused and how you can position your company relative to those large companies. So that's super important from an asset management point of view in the smaller companies. The other way also works very well. You're doing a huge amount of due diligence on private companies because when you go into them, you might be in that company, an investor in that company for maybe even a decade. So you really need to understand that landscape on the other side. And so when you're doing that, you can find great opportunities in the listed large cap markets or in listed small cap markets where you see great value and great opportunity to invest just in its own right. And so we've seen that both sides really work powerfully for the fund.
When you're assessing those really early stage healthcare companies, what factors are most critical to you in determining whether a new technology or a business model, whether it's drug, diagnostic or device or digital, has both commercial viability and societal viability?
Yeah, so the most important thing for me in an investment is, will this drug, this device, this biologic, whatever it is, service, will it have a significant impact on people's lives? Because that ultimately is what drives your financial return. If you have a drug or a device that really makes a huge difference, then there's going to be a high demand for it. If there's a high demand for it, there's going to be high volumes, you can charge a higher price, high profit margins. You can cycle some of that profit back into research and development and create a sustainable competitive moat and high self-sustaining growth rates. And that's what we want to see, companies that have very high potential for high self-sustaining growth rates for perhaps multiple decades. And that's what you see in companies like Cochlear and local examples, Cochlear and ResMed. So that's the characteristic we're looking for, and it all starts from is the clinical benefit really significant? That's the most important factor. Other factors, around management capability, trust. Do we trust management? Timing of the investment relative to timing of the acceptability of the product in the market, and how will that play out through the investment time frame we've got? Those sort of typical characteristics. The ability in different investments, different things are more important. So in device companies, reimbursement pathways critically important. That's often less important when you're considering biologics, because there's a really well established reimbursement pathway in biologics. So we have the core factor, I think, that ultimately it comes down to, is there going to be a huge demand for this product? Will it make a big difference to people's lives?
Given the high cash demand in sectors like biotech before they reach revenue generation, what strategies do you use to manage risk and protect capital within that part of the portfolio?
Yeah, so in biotech we have two, I think, discrete elements of biotech. We have what might be called big biotech companies. So, they're typically in the World Healthcare MISCI Index, for example, and they're multi-billion-dollar revenue companies. And then you've got the smaller sort of whippier biotechs that maybe are the sort of cash out style companies that you might be talking about there. I think when we're looking at it, it's around, first of all, portfolio, asset allocation, how we allocate across that portfolio and the risk spectrum. So we want to have some exposure to the small biotechs, but we don't want to have all the fund in it or even half the fund. We've got a proportion that we allocate to that. And then it's about how we allocate that proportion to individual opportunities. So that's your first, that's the first form of defence in terms of that. Then the second thing is looking at, we pay a lot of attention to what's the cash runway and what's the prospects of this company being able to raise cash when it needs to raise cash, and then altering our portfolio around that. So certainly that's something that we look at very, very closely. And the third thing I think is around timing. It's not always a great time to be putting money into the riskier end of biotech. The smaller end of biotech. Sometimes it's you're better off putting money into bigger end of biotech. And so we actively do that. So it's around, we look at those as two different subsectors actually, and we allocate, at a high level we allocate around that. So I think, within the smaller biotechs, it's really around making sure that they've got good runway and that they've got a plan for capital management, if they are able to raise cash and if they're unable to raise cash, through the cycle.
Are there particular regions or countries where you find healthcare investments to be especially compelling, given global differences in economic cycles and certainly global differences in regulatory landscapes?
Yeah, absolutely. So that changes throughout time as well. So sometimes the US is a very attractive place to invest. Generally, in fact, the US is an attractive place to invest in healthcare. It's a huge part of the healthcare market. And there's a lot of innovation that comes out of the US. We also find Europe, Japan, Korea, these countries, those OECD type countries as being very attractive. And you do find that, we constantly need to be looking at the regulatory landscape and how that might change over time and try and get ahead of that. That's really our view. But generally speaking, the US is always attractive. Investing internationally, it's really important in healthcare. Only 2% of global healthcare activity is in Australia, so 98% is international, and that's the same for our Australian healthcare companies too. So we do, as a natural fact, have around 35% of the fund in US, domiciled companies at the moment, and we like that construction. I do think. You go through times where the regulatory regimes change. Medical devices, it used to be normal that you would take your medical device first to Europe because the regulatory regime was much easier there, and then you'd attack the FDA. That's changed over the years because the regulatory regime in Europe's got a lot tougher and a lot harder to get through, and particularly with with Brexit. That has also added a complication for Australian-based companies. So typically now we see companies going straight to the US and trying to build in that market. So that's probably where we prefer to play.
Victor Windeyer, Portfolio Manager of the Perennial Future of Healthcare Fund. It's a great pleasure to have you here at our event.
Terrific. Thanks, James.
Thank you.